Today our topic is wound healing and the tissue repair. Wound, this is a break in the continuity of the tissues. Causes of the tissue damage. There will be physical and the chemical causes. Under the physical one, there will be the compromised blood flow, crushing, desiccation, incision, irritation, overcooling or overheating. While speaking about the chemical one, there will be the reasons like agents and the in-physiologic pH and physiologic toxicity on the reagents, proteases, vasoconstrictors and the thrombogenic agents. Wound repair, there will be the epithelialization. Injured epithelium has genetically programmed regenerative ability that allow it to establish its integrity. Free edges of the epithelium content to migrate until it comes into contact with the another free edge of the epithelium. There will also be the abrasion. Detrimental effect of the process of inhibition controlling the epithelialization occurs when opening is accidentally made into the maxillary sinus during the tooth extraction. There will be the three stages of the wound healing. One is inflammatory stage, reactive phase, proliferative stage and the remodeling phase. Proliferative phase is also known as regenerative or the reparative or the fibroblastic phase. In case of the remodeling, this is a maturational phase. In the inflammatory phase, the tissue injury lasts for 3 to 5 days. Two phases will be taking place here. One is the vascular and the another one is the cellular phase. In the vascular phase, there will be the initial vasoconstriction of the disrupted vessels and this causes the blood coagulation. Here, the histamine prostaglandin elaborated by the WBC. Vasodilation, which allows the plasma to leak and the leukocytes to migrate into the interstitial tissue. Fibrin from the plasma causes the lymphatic obstruction accumulate in the area of injury. This is called edema. Signs of inflammation are redness, swelling, warmth and pain and the functionalisia. In case of the cellular phase, there will be the triggered by the complement products. They act as a chemotactic factors and causes the neutrophils. There will be the margination, diabasis, contact on the foreign material, degranulation, lysosomal enzymes. These destroy the foreign materials. This digests the necrotic tissue, also aided by the monocytes and macrophages. By time, the lymphocytes accumulate at the site of tissue injury by the B lymphocytes. They are able to recognize the antigenic material. This produces the antibodies that assist in identifying the foreign materials and interact with the complements to lyse the foreign cells. In case of the T lymphocytes, there will be the helper T cell, suppressor T cell and the cytotoxic T cell. Lag phase. During the lag phase, there is no significant gain in the wound strength occurs. There will be the little collagen deposition. Fibrin, this is the material holding the wound. There will be the little tensile strength. Proliferative stage, the combined processes of the epithelialization, fibroblastia and the angiogenesis occur in order to replace the dead and the missing tissue. This lasts for nearly 2 days to 3 weeks. Fibroblastic phase, strands of fibrin form the lattice work. The fibroblast can begin laying down around the substance and the tropocollagen. There will be the ground substances like the mucopolysaccharide which cement the collagen. The fibroblasts secrete the fibronectin. This helps the stability of the fibrin, assist in the recognizing the foreign material. They act as the chemotactic factor for the fibroblast. They help to guide the macrophages along the fibrin that stands for the phagocytic fibrin. Fibroblast deposits the tropocollagen. Collagen produced in the excessive amount and laid down in the haphazard manner. Effectiveness of the collagen to produce wound strength rapidly, including during the fibroblastic stage, which normally lasts for 2 to 3 weeks. If the wound is placed under the tension at the beginning of the fibroblastia or at the end of the fibroblastia, at the end of the fibroblastic one, the stage here it is stiff, erythematous. They are able to withstand 70 to 80% of the tension. In case of the remodeling stage, this is the final stage. Many of the previous randomly laid collagen fibers are destroyed as they are replaced by the new collagen fibers, which are oriented to better resist the tensor forces of the wound. Here, this process will be slow, and the wound strength is nearly 80 to 85%. They allow the scar to soften. There will be the loss of edema in the remodeling stage. By the time there will be the vascularity that diminishes the wound erythema. Elastin is not replaced in the injured tissue. Loss of flexibility along the scarred area. They takes nearly 3 weeks to 2 years to complete. Wound contraction, final process, edges of the wound migrate towards each other, in which edges are now placed in the opposition wound contraction dimension. There will be problems like 3 degree, develop deforming and debilitating contractiness if the wounds are not replaced and the skins are graft. Can be lessened by the placement of a layer of the epithelium between the free edges. Factors that may complicate or delay the post-surgical wound healing. Local factors like desiccation, necrosis, pressure, trauma, edema. In case of the systemic factor, older age like the diabetes, obesity, hypothyroidism, immunosuppression, corticosteroid use, radiation therapy, chemotherapy, laboratory values, vascular insufficiency and smoking. Factors that impact the wound healing. Foreign material, 3 basic problems like the bacteria, non-bacteria foreign material is often antigenic. That decreases the fibroplasia, one is infection. Necrotic tissue, this causes the two problems. They serve as a barrier to ingrowth of the reparative cells. They serve as a protected hinge for the bacteria. They include the bleed and the hematoma, drugs, nutritional problems and the low temperature. There will be the distal aspect of the extremities. There will be the reduction of 1 to 1.5 degrees Celsius, 2 to 3 degrees Fahrenheit. Ischemia, decreased blood supply like a necrosis tissue. They lessen the delivery to wound of the antibiotics. WBC, this increases the chance of wound infection. Decrease the delivery of the O2. There will be the nutrients. These are caused by the tight or the incorrectly located sutures, improperly designed flaps, excessive external or the internal pressure on the wound, systemic hypertension, peripheral vascular disease and the anemia. Tension. If sutures are used to pull the tissues together forcefully, there will be the ischemia of tissue. If the sutures are removed too early, there will be reopened. This helps with the scar with the construction. If the sutures are left is too long in an attempt to outcome the wound tension, they spread open during the remodeling stage and the tract into the epithelium through which the sutures stand will epithelialize and leave the permanent disfiguring marks. Primary intention, the edges of the wound in which the no tissue loss are placed. Wound in which the edges are closely reapproximated, healing occur more rapidly and the low risk of infection. The wound repair and the minimum scar tissues will be there. Secondly, intention, the tissues loss has occurred, so a gap is left between the edges of the incision or the laceration. Tissue loss prevents approximation of the wound edges, healing is slower and produces the more scar formation. Primary intention like the wound repair lessen the amount of the reepithelialization, collagen deposition, construction and the remodeling. The primary closure should be performed in 6 to 8 hours of trauma, but the vascular areas may be closed up to 24 hours. Well repaired lacerations or the incisions are well reduced in the both structures. Second intention, a large amount of the epithelial migration, collagen of a deposition, construction and the remodeling. The wound is left open and heals by the formation of the granulation tissue and the construction. Extraction sockets, poorly reduced fractures, deep ulcers, large avulsive injuries of any soft tissue. Thank you.